Good afternoon. We are really pleased to bring you today's webinar from Dignitas International Office in Toronto. My name is Chun and I'll be your moderator for today. I am Dignitas Youth Ambassador and President of Dignitas Youth University of Toronto chapter. With me today are Max Holzberg from Royal St. George's College and brave Nyirenda, who is Dignitas International Teen Club Coordinator, visiting all the way from Malawi. Welcome to the both of you.
Thank you.
The theme of today's webinar is United for Change, Mobilizing Youth for Global Health, and it's intended to be a forum facilitated by youth for youth. We want to hear from students who support Dignitas International efforts in tackling global health challenges. About halfway in this webinar, we'll be taking audience questions that were submitted earlier this week, but there is still a chance for you to submit questions for Brave, Max, or myself. So feel free to email us at communications@dignitasinternational.org. Again, that's communications@dignitasinternational.org. We don't anticipate to have any technical difficulties, but if we do, please bear with us. We will try to rebroadcast ourselves ASAP. This webinar will also be recorded and uploaded on our YouTube channel. We'll do our best in the next 30 minutes to answer any questions. And without further ado, let's get started. So our first question will be for Brave and Max. When we hear about HIV, TB, and other global health epidemics, the need can sometimes be quite overwhelming and sometimes quite paralyzing. Brave, what makes you so passionate about tackling these global health challenges?
Yeah, as a Brave, I'm much passionate to fight global health issues because global health issues like HIV, TB, this can be a threat to global development.
Mm-hmm.
And each and every year, 2.3 million people are newly infected with HIV.
A year?
Yeah.
Mm-hmm.
And almost 9 million TB cases worldwide. So, furthermore, HIV is a leading killer for adolescents in Africa.
Mm-hmm.
So I'm really passionate to fight global issues and much involved in, as a person involved in caring for young people living with HIV. And I see the change or the success stories from the patient we serve.
Mm-hmm.
Yeah.
And Max, what makes you so passionate about tackling global health challenges?
I really like to help people, and I just want to do the best that I can to help tackle global health issues. It is absolutely overwhelming and paralyzing, but I think that if I can put as much of an effort in and put as many of my abilities that I have, no matter what they be, into tackling these issues, that I think a little bit of what I can do, and maybe you do, and Brave do, and everyone else does, we could all work together and do a little bit, then that'll help tackle these issues.
And have a very real rippling effect.
Yeah, it'll have a rippling effect, exactly.
Mm-hmm. And I really resonate with that a lot. I mean, as part of the Dignitas Youth chapter at U of T, I first got involved because I read our co-founder, Dr. James Ardvinsky's novel on Imperfect Offering. And it was a memoir that really changed the way that I viewed about humanitarian efforts. And it's because I read Dr. Ardvinsky's work that really motivated me to get involved with global health initiatives. And like you said, if everyone did a small part, in effect we have the rippling effects, but really we're uniting for change, which is what our webinar is all about today. So the next question will be for Brave. For Dignitas, one of the core beliefs is that everyone has the right to health. And Dignitas works really hard to break down those barriers and access to healthcare. So what does that mean to you?
Yeah, health right belongs to everybody. Unfortunately today, it's not everybody who has access to health care they need. As Dignitas, we know that if someone is healthy, can go to work, and even students, if they are healthy, they can go to school without problem. But if they don't have the right to help, they don't have the help they need, and they are sick, they cannot participate in contributing to national development. So as Dignitas, we believe that if we can provide care, quality care, and people they have right to help they need, they can participate in contributing to the future of their nation. Yeah.
What about you, Max? What does that mean to you?
To me, universal access to healthcare means that everyone, no matter what race, gender, socioeconomic background, sexuality, whatever it may be, will have access to healthcare as simple as getting treatment for a broken arm, or going for cancer treatment, or HIV/AIDS treatment, or TB treatment, because it's really important that everyone has access to that, because it creates a happy, prosperous society, but it also contributes to people's own happiness, and then they're going to want to contribute to society. And I think, as a Canadian, and I'm sure you as well, we both have this appreciation for our incredible healthcare system, and I want to make sure that everyone has an opportunity to have access to something like that.
No, and absolutely. Earlier this year, we saw this new campaign called Universal Health Coverage, and it's exactly what you're saying. Regardless of race, socioeconomic background, everyone should have the right to access to healthcare. So this question is going to be for Brave. What kind of role do you think youth, like young people, I guess, can play in addressing these kind of challenges?
Okay, if we're talking about global health issues like HIV, TB, particularly HIV, if we are talking about HIV, much of the group of people who are much affected is the youth themselves. And I believe that youth have a greater role to play in fighting against these global health issues by raising awareness so that the communities or people can understand, or youth themselves can understand about the global health issues. And by lobbying maybe the government to be engaged in fighting against global health issues. And maybe youth themselves can participate in fundraising campaigns for the global health issues, like what the Canadian youth are doing to participate in fundraising for global health issues.
Right.
Yeah, that's what I think. Yeah.
Can you tell us a little bit more about what Dignitas is doing to address the barriers to treatment and care?
Yeah, Dignitas is doing a lot in sub-Saharan Africa, particularly in Malawi, southeastern region of Malawi. As Dignitas, we provide medical health care to people living with HIV in southeastern region of Malawi. And normally we give this medical care to people living with HIV, TB, and the other non-communicable diseases. And as Dignitas, we also provide training to healthcare providers.
Right.
And we have trained a lot of healthcare providers in community hospitals so that people in Malawi can access the treatment or care, health care they need close to their homes. Because a bigger percent of Malawi people live in rural areas.
Right.
So Dignitas has made it to train more people in community health facilities so that they can get care closer to their homes. And another thing is we conduct research, different kind of health research, so that we identify gaps in health systems and know how we can fix those health problems.
And improve
because we work in partnership with the Ministry of Health of Malawi. Yes.
So Dignitas tackles these barriers through what you were saying, medical care, training of health providers, and also doing research as well. Max, as a high school student, what do you think, as Brave was mentioning what youth can do, what do you think teens can do here in Canada to make a difference for other, teens that don't have access to healthcare they need?
Well, first of all, I think that all teens in Canada should be aware of issues that are happening in our own country and around the world. Specifically, this issue of HIV/AIDS in Malawi and the transmission of it.
Mm-hmm.
And I think that once we are aware and we know what the issue is about, then we can move on to finding tangible ways to tackling the issue. For example, joining the Race for Dignity if it's offered at their school, or seeing if they can bring a Dignitas youth chapter to their school, just an example of Dignitas. Because I think that without the awareness, you could be going for a campaign, but you don't know the most effective ways to do it, and you need to find an effective way to do it, because that's the best way.
Right. And no, and I completely understand that. And I think, trying to get yourself more involved, especially through Dignitas Youth, is so important. And I mean, one of the ways that I've tried to get, involved with Dignitas Youth was earlier this year I went out to New York and participated in the Youth Assembly at the United Nations. And it was a very unique platform that brought together around almost 500 youth from around the world from more than 30 countries. And together we all talked about Millennium Development Goals, Sustainable Development Goals, and what youth can actively do in being a part of the post-2015 agenda, which we're very close to getting to. So yeah, I completely agree with that. So Max, you were mentioning a little bit about the Race for Dignity. Can you tell us a little bit more about your involvement with this fundraising and awareness building initiative?
Absolutely. So the Race for Dignity is a spin-a-thon, and ours specifically is with 10 Dignitas youth chapters from private and public schools across Toronto. And we gather in a gym, usually UCC. This year for the first time we're doing it at Branksome, and we gather in the Branksome gym.
So that's 10 schools all
10
in one
schools,
location.
there's about 400 people this year. In the past we've had 500. It's a crazy
Yeah.
busy day. It's a nightmare, but also really fun.
Yeah.
And we gather in the room, and everyone has bikes, and people are on their bikes, as well as going to activities for fun, like minute to win it games, but there's also a lot of awareness. There's posters and discussion, and we usually have a guest speaker come in. So people are A, having fun, B, promoting a good cause, and C, they're donating because there's a fundraising component to it. And last year for our 5th anniversary, our goal was to raise $50,000, and we just surpassed that goal, so we're really happy with that.
That's incredible.
Thank you.
Oh, that's amazing. That's so great to hear because, for myself, being involved at the university chapter, it's always been really difficult to get universities involved, especially students on campus to come out to these kind of initiatives.
Yeah,
but in 2012, we managed to even get some very motivated individuals, and just our chapter alone, we were able to raise $4,000. But
awesome.
I'm just trying to think if we were kind of like what you guys were doing, bringing more chapters involved, I can just only imagine how much more we could raise like that. So that's incredible to hear. So my next question, Brave, is you serve as a teen club coordinator.
Yeah.
You work with teens living with HIV. Most were actually born with the virus.
Yeah.
What kind of challenges do these young people face?
Yeah, my experience as the teen club coordinator, I've seen a lot of unique challenges among the adolescents living with HIV. And maybe first thing is to be HIV positive itself is a challenge to everybody. An adult or a youth or an adolescent or a child is a challenge itself. But the challenges which I see or have been seeing into these adolescents living with HIV, the first thing is to learn their HIV status is a challenge. To know that they're HIV positive and accept that they're HIV positive is a challenge. And the other thing is taking drugs, HIV life-saving drugs is also a challenge to take on daily basis. And the other thing is that to tell others about if they learn that they're HIV positive, so to tell others about their status, maybe friends, family members, is a challenge because they are afraid that maybe those people, they can tell others in the community and they can face a significant stigma in the community. So because of that, they stay quiet and they don't talk to anybody about their HIV status.
So,
So this is a great challenge.
So what does Teen Club do to address these challenges that these youth are facing then?
Yeah, because of this, that's why as Dignitas, we thought it wise to establish teen clubs across southeast region of Malawi, so that we can tackle these unique challenges of the adolescents living with HIV. Normally, teen club is a peer support group and information sharing for adolescents living with HIV, where we create a safe, welcoming, and nurturing environment for all adolescents living with HIV in Teen Club. And we also instill hope in these adolescents so that they can understand their HIV status and they can know the importance of HIV life-saving drug, and they can also learn how to cope up with the stigma in their communities. So that's what we do as a Teen Club.
Right. So what does that mean for Canadian youth like Max and their support? What does that mean to them?
Yeah, I think personally, and on behalf maybe of teens of Malawi, I would say thank you, Max, for your effort for participating in this fundraising for teens in Malawi. It means a lot, and it means a world to us. Malawi is one of the developing nations,
Right.
and it has limited resources. And so with the support of Canadian youth, it's great to Teen Club. And we have 11 Teen Club sites in southeastern region where Dignitas works. And this year we are planning to expand to 10 more Teen Club sites so that we can have 21. Because if we have a lot of Teen Club sites, it means we are going to reach many teens who are living with HIV. So your support, it saves a lot of life in Malawi.
And that's amazing, just doing something like Rakes for Digging can mean so much to the teens out there who are affected by HIV. Brave, can you tell us a little bit more about this youth initiative that you're working on with youth at the Toronto French School?
Yeah, for the first time, we want to pilot a project to connect youth of Toronto, Canada, and youth of Malawi to Songane Teen Club.
That's exciting. Wow.
And this is just a pilot, and we'll see if it will work. And normally we are planning to do it on 10th of April this month. And so we can see that the teens of Canada can interact with teens of Malawi so that they can chat, share experiences, know what is all about Malawi, and know youth of Malawi know much about Canada. What the youth of Canada they like, what are their hobbies, and the youth of Canada they can learn from, they can also know what you Malawian youth know, what are their hobbies, what are the temperatures like. So all those things, we want them to chat, and we want them to be to know that they are not different. They are all teens in the world, and they can share ideas.
That we are the same.
We are the same, and they know that it's very great to talk to someone in Canada, because they cannot expect that one day they will speak to somebody in Canada. And maybe Canadian youth, they were not thinking that they can speak to somebody in Malawi.
Right, of course, yeah.
So that will create a great thing during their life.
And it's an incredible opportunity, for Canadian youth to be able to speak directly to Malawian youth. I mean, it's an incredible cultural exchange, for sure. Max, how do you think students like to be engaged at the high school level? Like, what do you think is the best way to get them mobilized for global health?
I think that students my age in high school really like flashy, exciting campaigns, whether it be a really well-produced video, a nicely designed poster,
Or biking
sometimes, or a social media campaign. I think that just speaks to our generation of being very, they like flashy things, we're very visual and short attention span. So I think that if a social media campaign could really work where you have like a picture with some facts and what someone could do, because that really kind of gets to people on a visceral level and it's easy to share and stuff like that really goes viral. Or a campaign where you could text $5 to a number and that'll be donated directly to the teen club, and that's only $5 extra on someone's cell phone bill. And if you think about it, it's not a lot, but it definitely works if a lot of people do it because it's so simple. I'll use the example of We Day and saying that We Day is a really fun, spirited event. There's a lot going on, but at the same time, there's a lot of information that they tell you, but they do it well and they do it effectively because they tell people how they can get involved. They do it in a way that's engaging to people, and then afterwards, people go and they get engaged and they get involved in initiatives happening at their school. And I'd say the Race for Dignity is another example because it's fun, there's information, but people are also making a difference, and that's what's important. So it kind of tackles those three things.
Yeah, no, absolutely. I completely agree. And I think that's one of the challenges that we face a lot at the university level is how can we get these students engaged and mobilized? Because at the campus, like University of Toronto, there's 3 campuses, and the downtown campus is mostly a commuter campus. So it's often very difficult to get students to come together for like Race for Dignity. So, one of the ways that I've kind of looked at engaging students have been more of an artistic approach. I try to do more, art installations or, social media campaigns like you were mentioning to get us engaged because we're so interconnected. We're a very tech-savvy generation, so how can we better leverage that to get students like
It's a
us?
nicer way of putting it than
Yeah.
tech-savvy.
So this is great. So we're just going to take some audience questions now that were submitted earlier in the week. So this question would be for myself and Max. So have you organized, actually this question is from Laura, my apologies. Have you organized or are you planning to organize any special activities in conjunction with World AIDS Day or any other special days at your school to raise awareness about global health issues? Max, did you want to start with that?
Sure. In the past, we've always done at least one event on World AIDS Day, which has always been a bake sale for Dignitas as kind of our international organization that we're donating to. And we've also got gum donated from CanFAR, which is the Canadian HIV/AIDS organization. So we sell the gum at the same time, and the money from the gum goes to CanFAR, so we're also having a more local organization that we're supporting, so we have the two. But we've also tried to incorporate it into a lot of clubs at our school. So in the debate club, we've had debates about the best way to tackle HIV/AIDS. Is it research or is it funding, that kind of thing. So we found ways to get people involved. We've shown movies during lunch around World AIDS Day. And one year we actually went to a U of T event where it was Make a Human Ribbon, I think, for the 2015.
Oh yeah, that's right. Right out at King's College Circle.
Yeah, it was right at King's College
it was
Circle.
really big.
Yeah. So we've done stuff like that as well. We've had guest speakers come. We had a doctor a few years ago, I forgot his name, but he was really fantastic, and he came and he spoke and he got people excited. And that was the beginning of our launch for the Race for Dignity for that year. And next week we're having Brave come to our school. We're very excited for that. And he's going to kind of get people excited to go to the Race for Dignity and understand more about what it's about.
Yeah, no, that's great. I mean, we obviously at University of Toronto chapter, we also host Race for Dignity. But in conjunction with World AIDS Day, what we actually did in 2012, and what started this all condom art installation that you hear often with the University of Toronto chapter is our condom art installation. So in 2012, the theme for World AIDS Day was Turning Tide to Zero. So our chapter partnered up with the health and wellness centers, all 3 campuses, and what we did was we asked them if they could donate condoms to us. And what we ended up doing was we took the red condoms and we spelled the word HIV. And so we had this kind of pinned up on a billboard. And in fact, when students were taking the condoms, they were actually able to have two symbolic gestures. One was, when they took the condoms, the word HIV was slowly disappearing. And then the other thing was, underneath all of the condoms was also, an underlying message about HIV statistics. So there was that education component to it. So that's one of the ways that, we kind of looked at different ways to engage students at the university level, especially in conjunction with World AIDS Day. But now we do it more during the week of Valentine's Day, just for higher traffic.
That's smart.
It's all about the HIV prevention and awareness.
That's really funny.
So this question is for Braith.
Yeah.
This question is from Andrew. So Andrew asks, can you share a success story of a teen that is in teen club now, or one that has graduated from the program?
Yeah, I think I will have a lot of success stories and the testimonies that our teens have brought us, and to assure you that to assure you that program we understand that we see that it is working, because you can see the smiles on the faces of our teens. And for this, maybe I can share you only one story of a teen who is benefiting in Teen Club now. His name is Wisdom. Wisdom he went through a very difficult situation in his life. Because what happens is when he learned that he is HIV positive, it was very hard for him to believe and to accept this illness. And even he wanted to end his life.
Wow.
But like him, he joined the teen club when he was 16 years, that's 2010. And at teen club, he interacted with friends. He was counseled by teen club counselors, and learning new things, form friendships, and he was motivated and filled of hope. Then he went back to school. He passed his national exams with flying colors, and today, as I'm saying, he hopes to become one of the computer engineers in Malawi. And because of Teen Club, he was introduced to a national association for young people living with HIV, where he is a national executive member, as I'm saying now, and he stands as a role model for fellow HIV positive teens. So this is just one of the story which I can share you, but there are a lot of teens like Wisdom.
But that's an incredible story from Wisdom. I mean, for a young individual to have wanted to commit suicide just because of his HIV status, but realizing through Teen Club that HIV is not a death sentence anymore. But that's incredible, that you were able to see youth being able to fulfill their education potential and now becoming HIV advocates and being so involved in the community. Like that's honestly a great success story, and I think it really motivates community to realize just the amount of impact that we have in supporting teens like that across from Malawi.
That's a great story.
Yeah, that's.
So this question is for Max.
Mm-hmm.
What is it about Dignitas that compels you to want to make a difference in lives for other teens in Africa?
I don't know. I really like the organization. I think it's well run. They have a really good message. They run really good programs. I think they try and do, with interacting with teens in the teen chapters and the school chapters, I think they do a really good job with doing very simple formula for events and really working that into something fantastic. Like the Race for Dignity, I think, is a really good idea. You're riding on your bike and you're there with your friends and everyone's getting together.
Do you guys also have costumes?
And people have costumes.
So you're really wacky,
really wacky hair and jackets and stuff, and there's themes. So it's just this event that you could do for fun at a school, but they really take it on to the whole other level of this is for our organization, this is a fundraiser, and this is an awareness event, and it's not as complicated as doing millions of different awareness campaigns, but they really have one strong event that everyone remembers, and then throughout the year there's little things that they provide. So I really like being a part of the organization because of that event and the way it works and how they're really committed to the end of HIV/AIDS in Malawi, as well as engaging Canadian youth who may not be engaged in the issue at all with an event like that.
But you first got engaged with the race community when
Yes.
you were in grade 9, was it?
Yeah,
And now you've been playing that, coordinator role, or you're on the organizing team now?
Yeah.
Since grade 9 up until grade...
since grade 10. So grade 9 was like the test year, I guess you could say, and I was someone who knew a little bit about the issue, but didn't know a lot. And going to the event, I learned a lot about the issue, and I learned that there was ways I could easily get involved. And I think that just shows that the event is really successful and really fantastic because it gets people involved throughout the year and it unites people to get together in one cause. So yeah, I guess that's kind of my personal example of how it's affected it.
Right. So we have a next question from Caitlin. And this one's directed for me. Okay. So, what are some significant events or experiences have shaped you into an advocate for global health? Thank you, Caitlin. I think I need to take a moment to think about that.
Yeah.
Which significant event? I think the first significant event was kind of what I was mentioning earlier, was when I read our co-founders, Dr. James Arvinsky's Imperfect Offering book. It was such a heartbreaking and compelling narrative, talking about what the situation was like, especially during the Rwandan genocide, was especially compelling. To see someone like Dr. Arvinsky still stay in the field and still try to make a difference in people's lives when the genocide was still happening and ravaging on for so long. And it just made me really think about, what I could do, the introspection and reflection of what could I actually do as a young individual, and how could I even shape my own career alongside of the studies that I wanted to do to be an advocate for global health. And I think, Dignitas, I really credit Dignitas for deepening my understanding about global health. Dignitas has been really great. I've been serving as, the marketing communications assistant for a while now, but reading more about the progress that everyone's making, not just Dignitas, the organization itself, but other organizations around the world, all working together, united for change, to make a difference for those affected with HIV. And it's just seeing everyone, so passionate. It's hard to not feel passionate at the same time. It's a little bit contagious almost. So I would say, Caitlin, that's kind of Dr. Arvinsky book, and seeing others also equally as compelled to make a difference really shaped me into the advocate for global health that I am today. This next question is for Brave. Can you tell us a little bit more about Teen Club and how it works and what kind of impact the program is having? And sorry, this question is from James.
Okay, thanks, James. Teen Club, as earlier said, is a peer support group and information sharing forum for adolescents living with HIV. And at Teen Club, there are three things happening. The first thing is that teens, they play interactive games and team building games for fun and want to build their self-esteem. And the second thing is that they are provided with medical checkups and they receive their HIV life-saving drug on the same day. And the third thing, we provide education on health issues, such as sexual reproductive health issues, and we provide nutrition education, we provide life skills education, and we also teach them on the importance of HIV drug and how they can take correctly. And the other part, which to reduce issues of stigma, we also engage them in how they can tell their stories about the HIV to friends and the family members who can assist them on how to remember to take drugs.
Mm-hmm.
Because as teen club coordinator or teen club personnel, we meet them once in a month on a Saturday.
Okay.
Yeah, we meet them on a Saturday because we don't want to do these activities within the week because most of these adolescents are in schools.
Right.
So if we do it within the week, thereafter they can be absent from school.
Mm-hmm.
Whereby as teen club we also promote education
Of
for
course.
these adolescents because they have brighter future.
Mm-hmm.
Yeah, so that's about teen club. And we know that it has a greater impact
Mm-hmm.
in the adolescents living with HIV. This has been is so because we conducted the research in 2012 as Dignitas, and our research results shown that adolescents who are attending teen club are 3 times more likely to stay on HIV
Treatment.
life-saving treatment
Mm-hmm.
more than their counterparts.
Wow.
So that's why we see this program that it is working, and you can see if how this maybe you can call it observational survey. If you can just come to teen club and see how the adolescents interact with friends, how they share in group works and whatever. So that makes us that this program is really working, and with the results of our research,
Mm-hmm.
that's what is prompting us to expand further
To the
to
21.
other years.
To the 21
Yeah.
teen clubs, right?
Yeah.
And I think that's I mean, hearing a story like what you were saying about wisdom is just so it's so great because we like those are the success stories that we want to see, and we do see it right with Dignitas. And I mean, it's such a interesting time of a teen's life, especially when you're just getting to know your own body, getting to know what you want to do in life and your career. And then teen clubs actually does provide that safe environment to have that conversation. I think that's what you were saying the most was that stigma that comes with it. Like, how do you have a conversation about your HIV status but not being judged by it?
Yeah.
And I think that's, it's fantastic work what you do, Brave. We have some questions that just came in from the email. We have a question from Maria, and Maria asks, how can people donate to Dignitas International? So I'll take this question. So one of the ways that people can donate is to visit our website at dignitasinternational.org, and if you go on under ways to donate and ways to give, you actually see a whole slew of ways that you can donate. And it's not just monetary, but Dignitas has this unique way of giving, which is through Bitcoin. In other ways, you can also donate your car if you don't need it, and we provide free towing as well. And we also have airplane points that we actually had as a campaign that successfully worked just this past month. So there are definitely a lot of ways that you can donate, Maria. So please feel free to check out our website at dignitasinternational.org, and look for ways in which you think you can appropriately donate to us, and we'd be really happy with your donation. We have another question, which is from Simon, and this question is for you, Brave.
Yeah.
What was Malawi like before treatment was available?
Yeah, let me take you 10 years ago when we started as Dignitas. It was really bad because it was very hard to get to have treatment because it was only in big cities in Malawi, whereby we have only 4 big cities, and almost 75% of Malawians, they live in rural areas and they depend on farming. And just to say it, Malawi is one of the poorest nations. And it's very difficult if they are sick to travel to the hospital to get drugs. It's very difficult. People were dying under trees because of HIV.
Wow.
And almost 2/3 of death in Malawi by that time was due related to HIV.
Wow.
So that was like 10 years ago before treatment.
And even when they did have treatment, did they have to, because they, like you were saying, they live in rural communities, right?
Yeah.
Did they have to walk? Like, how long did they have
Yeah,
to walk?
so
to get
they have
treatment?
to walk almost over 150 kilometers
Wow.
to reach to the health facility.
And how many days, or how many days or
So,
weeks does that
so
take?
that can take them, working on food can take them maybe 2 days walking.
Wow.
Yeah, so that's a great challenge. It was very bad before treatment.
Mhm.
And
Yeah.
there's no real means of other transport other than walking?
As Elia said, it could be there would be a transport or a bus, but to pay for it
Mm.
is a challenge
I see.
because they depend on farming. They are not working. It's just farming. That's
Right.
the challenge.
So their only means of income is just the farming.
Yeah.
So if they take the bus, that already takes so much out of the income that they are getting.
Yeah. That's it.
That's. I am so glad that Dignitas has set up so many more centers
Yeah.
to increase the access.
Yeah. So the goodness of now Dignitas right in Southeast Zone has done a good job. Like I was saying previously, that what Dignitas has done has trained health personnel in community hospitals
And these are
in the rural.
and these are local Malawians that are being trained.
Yeah. So they are providing health care in community hospitals. They're providing HIV drug in community hospitals in across the Southeast Zone. And if you can visit each and every community health facility in Southeast Zone, Dignitas is there. Is the one who scaled up the services to community health facilities.
Well, that's
Yeah.
that's such a such a before and after picture of what
Yeah.
Malai was like before and after treatment. And I'm it's amazing to hear just how much Dignitas has been really impacting those affected with HIV. We have another question from Jake. This is for Max and myself.
Mhm.
And so the question is, do you feel like your life has been changed by your involvement with the Race for Dignity or helping teens with HIV?
Wow. It's a big question, Jake. It's a good one, though.
Would you like to go
Sure.
first?
I would say that it's definitely had an impact on my life, for sure. This is something that means a lot to me, and tackling this issue means a lot to me. It's a big part of my life. This is one of the events I really look forward to every year. I don't know if changed is the best word,
Or
but
maybe even like what you're because you're in grade 12.
yeah.
So is that at all shaping the way you think of the career that you want to take at all?
Yeah, absolutely. It's definitely shaping the way I want to contribute to the world and helping people and being there for others. So I would say that it's definitely had a huge influence on my life. So yes, maybe change is the right word.
Okay.
Good question.
And what are you planning? Actually, this is out of curiosity. What are
Yeah.
you planning to do with? I mean, where have you
Ooh.
applied? Are you gonna maybe do? Eventually, want to do a master's in public health?
I have no idea. I don't really know much about what I want to do. I'll be going to university next year at University of King's College in Halifax.
Wow,
So-
that's so far away.
I'm hoping they'll have some programs like this, or if not, I can hopefully bring a Dignitas Youth chapter
Yes.
over
start
to
another
the school.
Dignitas
We'll
Youth.
see. I have to kind of see what the new environment's like. But I'd like to continue this wherever I go in my life, even if it's in my own personal life.
Right. No, that's great that you have that motivation for continuing involvement with Dignitas wherever you go.
Thank you.
I think for myself, in terms of what's changed by my involvement, I think it's definitely, I would say I would not have understood the depth or the capacity of my leadership skills, I
Mhm.
think. Having been involved with Dignitas for almost 7 years now, and I got involved pretty late. We didn't have a Dignitas Youth chapter
Right.
at my high school,
Mhm.
so I got involved really my first year at university. But I've been sticking with Dignitas, and I just feel like it's, the work that Dignitas is doing has really shaped the way I think about how we approach, just global health issues. And it's what Ray was saying, is working within the community. And I think that's so important, because I've seen so many organizations and been involved with others where, it's mostly just kind of parachuting aid.
Mm-hmm.
But, it's not so much that one-time
Yeah.
relief that they need. It's kind of like the whole discussion that I'm seeing on Twitter and all the public health officials is that we need to build community infrastructure. We need to build better health systems, and that's kind of what we're seeing a lot with Ebola. Is that there were no health systems in place, and that's why we see so many people that could have been saved but were not saved because those health systems were not in place.
Yeah.
And I don't think I could have, really understood the depth of what that meant had I not been so involved, with helping with race reducing or helping with teens living with HIV. And so honestly, I really credit Dignitas for deepening my understanding in that way. I have this other question from Marilyn, and that's for you, Brave. And Marilyn asks,
all the questions.
and Marilyn asks, what are some of the questions that HIV and teens ask the counselors?
Okay. Most of the questions, like, as I have HIV, will I be employed? Will I get a job even if I can continue school? The other thing that I'm growing up, will I get married? The other thing that, I have HIV. HIV does not have cure. So does it mean even if I'm taking drugs, still it cannot benefit me because I'm HIV positive? You are saying it's not a cure, and you are giving me these drugs for what? So all those questions are the ones which Teen Club addresses so that they can understand these questions. Yeah. So the other thing is that I'm HIV positive, and you are encouraging me to tell maybe my guardian when they are changing guardians. So will this guardian not discriminate me? So as a Teen Club coordinator and Teen Club personnel, we try to let them understand why we are encouraging sometimes to share the status with the guardian or family member so that they can be helped and they can make them remember about the taking drugs. So these are some of the questions which the teens ask. And the other thing, I earlier said that we teach about sexual and reproductive health.
Of course, yes.
And all these issues are covered in those in this topic, because sometimes if they come across with the changes which take place between childhood to adulthood, the adolescence stage, it makes them feel bad, as if they think it's HIV, while this is normal. So these are some of the questions which these adolescents living with HIV, they ask.
Or do they even ask about, you were saying they ask, how do I talk to my guardian when they discriminate me?
Yeah.
What about teens that are, say, in a relationship with someone? Do they ask about, how do I have a conversation with my boyfriend or my girlfriend so that because they obviously don't want to transmit it, but do they ask about how they should communicate with them?
Yeah, this is that's another question which they ask. Can I tell my boyfriend or my girlfriend about this? What will be the result if I tell this boyfriend of mine or girlfriend of mine? So as Dignitas, as Teen Club, we also impart knowledge on how best they can communicate the status. But it's true, if they are communicated that as a girlfriend, as you can say, I'm HIV positive. Just like that, definitely the relationship will end there.
Right.
Because it's not the right way to communicate about HIV status.
Especially if they don't understand what it means to be HIV positive, right?
Yeah.
I have one final question, I think, and that's for from Nelson, and it's it's directed more towards me. It's how can students learn more about getting involved with Dignitas Youth, and what can we do immediately? So that's a good question, and I think throughout this webinar we've been touching a lot about the ways in which young people like yourself, Nelson, can get involved with us. And that's by checking out which schools have a Dignitas Youth chapter. So if you go to Royal St. George's, definitely get in contact with the youth chapter there, and maybe you'll also meet Max there as well, or the next people that are going to succeed over him. And of course, at the university levels, feel free to also get in contact with us. And in terms of what you can do immediately, you can also, participate in whatever Race for Dignity events that happen. And we also have, upcoming events such as a Real Talk event that that's going to be happening soon this month on April 14th. So Nelson, I will direct you to a website, to dignitasinternational.org. Go under our tab, get involved, and you'll find a whole slew of ways that you can get involved with us. So thank you for your question.
Yeah.
So I think that's all our questions. And before signing off, I want to thank everyone who tuned into today's webinar. I also want to give a special shout out to the following schools: Appleby College for being a long-standing supporter, and they also held their own Race for Dignity earlier this week. And best wishes to Branksome Hall, who will be hosting Race for Dignity on April 17th. And they will be doing it with participating schools of Canada College, Bishop Strong School, Greenwood College, Vaughan Road Academy, Royal St. George's College, St. Clements. And a final shout out to our university chapters, notably Dignitas Youth Western and U of T. Thank you for all that you do. And for those interested, as I had mentioned earlier, we have this fantastic youth event coming up called Real Talk. And this will be happening on Tuesday, April 14th in Toronto. And Brave himself will actually be sharing his experience working with HIV-positive teens in Africa. And we will also be having a performance by spoken word artist Jordan Vera. So it really promises to be a special event at Valdez Restaurant with great food and music by DJ Feel Good Smalls. So for more information on how to buy tickets, you can visit our website at dignitasinternational.org. And to learn more about how you can get involved with Dignitas Youth, please feel free to email us at info@dignitasinternational.org, and that's again info@dignitasinternational.org. You can also check out the latest updates about Dignitas International by engaging with us on social media such as Facebook. So that'll be facebook.com/Dignitasinternational, and on Twitter and Instagram @DignitasINTL. Thank you everyone for tuning in. Shall we say bye?
Sure.
Yeah.
Bye.